Heart rate variability, HRV, is a crucial measure of the variance between heartbeats. It provides insights into the stress levels of our nervous system. A higher HRV indicates a more resilient and adaptable system, while a lower HRV suggests stress or potential health issues. Heart rate variability, HRV, measures the variance between heartbeats, providing insights into the stress levels of our nervous system. A higher HRV indicates a more adaptable and resilient system, while a lower HRV suggests stress or potential health issues. Understanding HRV is crucial for assessing autonomic nervous system function and overall well-being. Heart rate variability, HRV analysis, involves preprocessing electrocardiogram (ECG) data to extract RR intervals. This data undergoes various analyses: time domain, frequency domain, and time frequency. Nonlinear methods also play a role. Each technique offers unique insights into cardiac health, aiding in prognosis. Understanding these methods is crucial for comprehensive HRV assessment. Heart rate variability analysis involves preprocessing electrocardiogram data, including filtering and ectopic interval correction. Time domain methods use statistical measures like mean RR intervals. Frequency domain techniques, such as Welch and Berg periodograms, analyze spectral components. Nonlinear methods, including Poincare plots and sample entropy, offer insights into complex heart dynamics. Accurate preprocessing is crucial for reliable heart rate variability analysis. Preprocessing involves constructing a time series from interbeat intervals, interbeat interval, derived from R-wave electrocardiogram intervals. This sequence is crucial for accurate heart rate variability analysis. Artifacts in the raw data are corrected to ensure precision, enhancing the reliability of subsequent analyses. Constructing a time series from interbeat intervals involves using R-wave electrocardiogram intervals. The R-wave is the peak of the QRS complex in an electrocardiogram wave. Artifacts in raw data are corrected to ensure accuracy in the time sequence, crucial for analyzing heart rate variability and autonomic nervous system function. The autonomic nervous system, ANS, regulates involuntary physiological functions, including heart rate, digestion, and respiratory rate. It consists of the sympathetic and parasympathetic nervous systems, which work in tandem to maintain homeostasis. Understanding the autonomic nervous system is crucial for comprehending how various factors influence heart function and overall health. The autonomic nervous system influences heart function through respiration, thermoregulation, blood pressure, and cardiac output. Respiration affects heart rate variability, while thermoregulation adjusts blood flow to maintain body temperature. Blood pressure regulation ensures adequate perfusion, and cardiac output reflects the heart's efficiency in pumping blood, crucial for overall cardiovascular health. The autonomic nervous system regulates blood vessels, glands, and muscles, including the heart. It maintains homeostasis by controlling involuntary functions, ensuring optimal blood flow and organ function. This system is crucial for adapting to internal and external changes, balancing sympathetic and parasympathetic activities to maintain cardiovascular health. Heart rate variability, HRV, reflects the balance between the sympathetic and parasympathetic branches of the autonomic nervous system. This balance is crucial for maintaining optimal cardiovascular function and adapting to internal and external changes. Heart rate variability is a key indicator of recovery and activity phases, highlighting the body's ability to respond to stress and maintain homeostasis. Electrocardiograms, ECGs, are crucial for monitoring heart activity. Various types, such as resting, stress, and Holter ECGs, capture electrical signals to assess heart function. Accurate recording involves placing electrodes on the skin to detect electrical impulses, providing insights into heart rhythm and potential abnormalities. This data is vital for diagnosing conditions and guiding treatment decisions. The heart, central to the cardiovascular system, ensures oxygen and nutrients reach organs. On an electrocardiogram, a cardiac cycle or heartbeat is depicted as a PQRST sequence. The isoelectric line represents the baseline, crucial for identifying deviations in heart activity. A PR interval less than 0.125 seconds suggests an atrioventricular shunt, often due to Wolff-Parkinson-White or Lone-Ganong-Levine syndromes. A PR interval over 0.2 seconds indicates atrioventricular block, potentially first, second, or third degree. Mean heart rate below 60 signals bradycardia, while above 90 indicates tachycardia, with over 120 being threatening. Time domain heart rate variability analyses are categorized into statistical and geometric methods. Statistical measures are derived directly from the interbeat interval series, providing insights into heart rate variability. Geometric methods, on the other hand, involve constructing geometric shapes from the interbeat interval data, offering a different perspective on heart rate variability analysis. Statistical time domain measures are derived from the interbeat interval IBI series. These measures include the mean and standard deviation of interbeat intervals, providing insights into heart rate variability. Geometrical measures, on the other hand, involve plotting interbeat intervals to assess heart rate variability, offering a different perspective on cardiac function. The RMSSD index, calculated in 30-second segments without overlap, is crucial for analyzing non-stationary RR interval series during incremental exercise. RMSSD, the square root of the mean of the sum of squares of differences between adjacent RR intervals, reflects vagal tone, providing insights into autonomic nervous system activity. Power Spectral Density, PSD, estimates provide insights into the power distribution across different frequency bands in a time series. This method helps in understanding how various frequencies contribute to heart rate variability, offering a detailed view of autonomic nervous system activity through spectral analysis. Heart rate variability analysis in the frequency domain uses spectral decomposition of the RRI signal via fast Fourier transform. It identifies three key frequency bands: high frequency, 0.15 to 0.7 Hz, linked to respiratory activity; low frequency, 0.04 to 0.15 Hz, associated with baroreceptor activity; and very low frequency, 0.003 to 0.04 Hz, related to thermoregulatory functions. The heart rate time series is non-stationary, making Fourier analysis unsuitable for observing heart rate variability during stress and relaxation. Instead, time-frequency analysis methods like short-time Fourier transform, Welch, Berg, Lomskargel, and Wavelet are more effective for understanding autonomic nervous system operations. Analyzing heart rate variability during maximal effort exercise involves examining non-stationary RR interval series. The scaled color map and surface plot of Power Spectral Density reveal dynamic changes in autonomic nervous system activity. These visualizations help in understanding the time-frequency domain characteristics of heart rate variability, providing insights into how the body responds to intense physical stress. Low frequency, LF, and high frequency, HF components in heart rate variability, HRV analysis, reveal autonomic balance. LF/HF ratio indicates sympathetic parasympathetic balance. A ratio below 2 suggests healthy stress levels. Total power reflects overall autonomic activity, primarily influenced by sympathetic activity. Changes in these measures can indicate shifts in vagal and sympathetic activities, crucial for understanding autonomic function. Nonlinear methods in heart rate variability, HRV analysis, address the heart's complex control system, which linear methods cannot fully capture. These methods include Poincare plots, entropy measures, and fractal analysis, providing insights into the heart's dynamic behavior and autonomic regulation. They offer a more comprehensive understanding of heart rate variability, crucial for assessing cardiovascular health. The heart's complex control system suggests that linear methods may not fully capture heart rate variability, HRV. Consequently, various nonlinear methods have been developed to provide a more comprehensive analysis. These methods offer insights into the intricate dynamics of HRV, enhancing our understanding beyond what linear approaches can achieve. The Poincare plot is a key nonlinear method for analyzing heart rate variability. Each point represents successive beats, with the x-axis as the current RR interval and the y-axis as the previous one. Heart rate variability is quantified by fitting geometric shapes to the data, providing insights into heart function beyond linear methods. Heart rate variability, HRV, analysis in cancer patients reveals significant insights. Early detection stages show distinct heart rate variability patterns compared to advanced stages. Chemotherapy impacts heart rate variability, often reducing variability. In hospice care, heart rate variability further declines, indicating disease progression. These patterns, sourced from Taipei Veterans General Hospital, highlight heart rate variability's potential in monitoring cancer stages and treatment effects. Heart rate variability. Nonlinear methods provide insights into autonomic nervous system dynamics. Key techniques include Poincare plots, approximate entropy, sample entropy, and detrended fluctuation analysis. Correlation dimension and recurrence. Plot analysis reveal complex patterns, while fractal dimension and large-scale dimension density offer a deeper understanding of physiological variability. Heart rate variability, HRV, is a crucial indicator in understanding the autonomic nervous system's role in various pathologies. Reduced heart rate variability is linked to increased mortality in cardiac patients, while elevated heart rate variability can indicate better cardiovascular health. Conditions like diabetes, hypertension, and depression also show altered heart rate variability patterns, highlighting its diagnostic and prognostic value in clinical settings. Heart rate variability, HRV, is notably affected by drugs, smoking, and alcohol. Medications can alter heart rate variability, revealing their impact on the autonomic nervous system. Smoking increases sympathetic activity, reducing heart rate variability. Similarly, alcohol consumption decreases heart rate variability, indicating sympathetic activation and parasympathetic withdrawal. These insights are crucial for understanding cardiovascular implications. Schizophrenia is linked to increased cardiovascular disease risk, including stroke and heart failure. Elevated cortisol may heighten dopaminergic activity, worsening symptoms. Clozapine treatment in schizophrenia can cause autonomic dysfunction due to anticholinergic effects, raising heart rates. Monitoring heart rate variability can help identify autonomic issues more effectively than traditional serum level tests, emphasizing the need for careful cardiovascular monitoring in these patients. Schizophrenic patients exhibit increased heart rate responses to positive emotional stimuli, likely due to reduced parasympathetic activity. This altered physiological responsivity is specific to positive emotions. Antipsychotic drugs, which block dopamine receptors, support the theory of excessive dopamine in schizophrenia, though they may not alleviate negative symptoms, indicating additional factors beyond dopamine imbalance. Research indicates that individuals with schizophrenia exhibit distinct differences in facial emotion recognition under psychosocial stress compared to control groups. These differences may be linked to altered stress responses, affecting their ability to accurately interpret emotional cues. Understanding these variations is crucial for developing targeted interventions to improve social functioning in schizophrenia patients. The IPSVR project, led by Henning Hachtel, explores stress impacts on mental states, particularly in forensic contexts. It examines stress's clinical effects on facial emotion recognition, subjective stress perception, and cognitive performance. The study uses the Montreal Imaging Stress Task and evaluates both nonverbal and verbal facial emotion recognition, alongside stress questionnaires, to compare study and control groups. The IPSVR protocol involves a structured sequence of tasks, starting with informed consent and medication inquiries. Cortisol and KAB measurements are taken at multiple intervals. Participants undergo the Montreal Imaging Stress Task and face emotion recognition tests. The protocol includes filler tasks, like viewing landscape magazines, ensuring comprehensive data collection on stress and cognitive performance. Comparing heart rate variability, HRV, between control and schizophrenic groups reveals significant differences. The control group shows a higher mean interbeat interval, IBI, and standard deviation of NN intervals, SDNN, indicating better autonomic regulation. In contrast, the schizophrenic group exhibits reduced HRV metrics, potentially influenced by clozapine medication, suggesting altered autonomic function and stress recovery. Examining the DFA alpha values, we observe significant differences between control and schizophrenia groups. The alpha 1 and alpha 2 values suggest altered autonomic regulation in schizophrenia, potentially indicating sympathovagal imbalance and heart rate variability dysfunction. These findings may relate to conditions like congestive heart failure, highlighting the importance of understanding autonomic changes in mental health disorders. Analyzing heart rate variability in schizophrenia, we observe a DFA alpha all of 0.960, indicating altered autonomic regulation. The mean interbeat interval is 575.5 milliseconds, with a mean heart rate of 104.8 beats per minute. Notably, the SDNN is 41.6 milliseconds, and the RMSSD is 38, reflecting reduced parasympathetic activity. These metrics highlight significant autonomic dysfunction in schizophrenia. Cortisol levels in schizophrenia patients show significant deviations from baseline, indicating altered stress responses. This dysregulation can impact cognitive functions and emotional stability. Understanding cortisol's role is crucial for developing targeted interventions to manage symptoms effectively. In schizophrenia, cortisol levels can indicate stress response variations. Baseline cortisol levels in schizophrenic patients often differ from controls, impacting emotional regulation. Understanding these differences is crucial for developing targeted interventions. This analysis provides insights into the physiological underpinnings of emotional processing in schizophrenia, setting the stage for examining emotion detection and comparison in subsequent analyses. In emotion detection, we compare schizophrenic and control groups. Significant errors occur in recognizing emotions like anger, sadness, fear, and disgust. Mean performance varies, with notable differences in anger, happiness, sadness, and disgust. However, no significant performance changes are observed across sessions for either group, indicating consistent emotional recognition challenges in schizophrenia. Examining stress effects in FE one-face emotion detection and MIST, we focus on electrodermal activity, EDA, in schizophrenic and control groups. Skin conductance response, SCR, is crucial for understanding emotional processing. IPSFER measures EDA, providing insights into physiological responses under stress, highlighting differences between schizophrenic and control participants. Ensure your results are consistent and explainable. Greater variability often indicates a heart's better adaptability to changes, suggesting a healthier individual. Thank you for your attention.